So substance use disorder is essentially a misuse of certain illicit and legal substances. That includes alcohol, nicotine, just to name a few, but also things like cocaine or heroin as well. So when we look at substance use, we do view it within a spectrum. Some patients are able to socially use certain substances like marijuana or alcohol, and that's on like one end of the spectrum, versus those who, have cravings, addictions, withdrawals, and have to become more dependent with every single use. So within that spectrum of use, we categorize when it becomes more pathological. That's when it becomes more of a substance use disorder. So some of the most frequently used substances by adolescents includes alcohol, nicotine as well, not so much cigarettes, but the emergence of the vaping epidemic, which has taken over, as well as marijuana. Those are some of the top substances that are experimented with. So it actually varies with substance. So for example, when it comes to nicotine and smoking cigarettes, those uses have actually decreased over the generation. However, with the vaping epidemic, all of the gains that we had made in a public health initiative to erase smoking have been eliminated within the last 10 years just by the use of vaping alone. Whereas alcohol has actually remained a little more steady throughout the last 10-20 years. This is where it's important for psychiatry to kind of intervene, because there are a lot of comorbid psychiatric issues that do coincide with the use of substances. For example, ADHD, conduct disorder, those are big ones that sometimes we overlook when they go hand in hand with substance use. So the researchers actually identified a certain number of key factors that will influence whether or not a child or adolescent will use substances. Some of the most important ones include the amount of school involvement and engagement, as well as whether their peers are using substances as well. Those are key factors to indicate when looking for risk behavior. So one of the main concerns with cannabis use is that we don't have a lot of long-term data that suggests what the effects are for children and adolescents. Some of the preliminary evidence shows that long-term use of cannabis can lead to memory difficulties, learning behaviors, as well as an increased risk of psychosis. So those are the main things that we have to watch out for, especially as marijuana becomes more legalized. So vaping is actually 2 to 3 times more common among adolescents as compared to the adults to which vaping was initially marketed to. So while vaping is not, one of the biggest misconceptions with vaping is that it's quote-unquote safer compared to cigarettes, when in actuality there are studies that show vaping contains high amounts of heavy metals as well as carcinogenic substances. So some of the main principles really involve focusing and tailoring your treatment to the child. So that also means like identifying any trauma the child might have experienced, or identifying any co-occurring psychopathology, depression, anxiety, again, conduct disorders or behavior disorders. Your treatment revolves around addressing the acute needs of the child. So the biggest thing too is, the longer you use the substance, the harder it is to come off of it. So when you can intervene early on, especially when you identify the social, psychopathological behaviors affecting or driving their use, you have a much better outcome for the child overall. Primary care is kind of positioned in this unique ability where they will see most of these adolescents before they're even referred to a psychiatrist. Sometimes the substance use is the primary problem for these patients, but it might be underscoring an underlying psychopathology. As a primary care provider, you have the unique ability to intervene early on and then refer those patients to the appropriate help that they need, as well as making sure they get the resources not only to help with their substance abuse, but also the factors that might be driving it.